thank you so much for taking the time to chat with us today. We're really excited to be presenting you with the Founder Award. The work you've done in the field has been incredibly impactful, and it has definitely shaped the trajectory of how patients with HIV/AIDS are receiving care today.
Well, I want to say thank you back to you and to the Legal Counsel for Justice. I equally admire the work that you all have done over the years and what you stand for in the response to the HIV epidemic in Chicago. So I'm very honored to be recognized in this way. So thank you.
I'm curious to know, from your perspective, working in this field, the evolution, hopefully the decrease of stigma around HIV/AIDS.
Yeah, I mean, it's very important to put this whole look back in context so that we use this information in a proactive way now. I think Ronald Reagan didn't say the word AIDS for the first 4 years of the epidemic. And it took, and this is the important lesson from that, it took solidarity among those who were affected and the treatment community, the public health community, and advocates within the LGBTQ community. And lawyers played an incredibly important role in that on an individual level, protecting people's rights to access to health care, their rights to freedom from discrimination, to continue in the workplace, children with HIV and their rights to attend school. These were all part of the larger context of HIV here in the United States and also around the world. And the AIDS Legal Counsel, as it was known then, was a critical part of that effort because they stood with people with HIV in their legal battles, in their right to access to care or to housing or to education. And they let them know they had rights that they could defend in a court of law. They also stood at the policy level for the overall rights of the population and people at risk or perceived of the population. So I can't say how important it was.
I'm curious to know also, from your perspective and your experience, do you have any advice that you would like to impart on doctors and lawyers coordinating services for the benefits of their patients?
For clinicians out in the field working in a community health center, it can be isolating. And so the first thing is a community or a group of fellow caregivers where you can share your frustrations and your observations. The real problem is we have a dysfunctional and fragmented health system, and so we don't have enough of those services to be able to provide to people. But the community is the place to begin, where you can develop resilience. One of your questions was, how did you maintain just in those early days when there was so little support and no treatment? And really the answer was the solidarity that we felt with other people in doing similar care around the world, and solidarity with our patients, where even if we couldn't cure them, we could walk with them, we could make them feel better, we could let them know that they were deserving of full attention and care. And that's what people want at all levels, even forget HIV, just from a medical group, is someone to respect their dignity, to listen to them, and then to do everything they can to try to help them.